Hilton, a patient advisor. I was trained as a patient researcher through the O'Brien Institute program at the University of Calgary's Cummings School of Medicine. Some of the projects that I have been involved with are a study on optimizing centralized intake for First Nations people with rheumatoid arthritis, a study on the hidden pathways that patients use when confronting the challenges of chronic disease, a study on understanding patients with low back pain experience with family physicians and diagnostic imaging, and a study on understanding patient perspectives on stroke prevention therapy decisions in atrial fibrillation. I have presented on patient engagement at various conferences and workshops. My favorite speaking engagement was when I was, after explaining the virtues of engaging with patients more, I was confronted by an overworked physician who threw up his arms and said, "I'm so busy doing my work and trying to see all my patients that I really don't have time for one more thing." My response was to simply explain that in fact patient advisors and patient researchers are not trying to add to the workload of clinicians, but rather we are there to reduce the work of the clinicians. Accomplishing this by making the clinicians aware of the hidden concerns and needs of the patient, by perhaps having improved patient compliance with prescription medicines and protocols, by perhaps reducing the number of patients needing care with the introduction of improved communications around self-care and complementary therapies. I'm also involved as a patient advisor with Alberta Health Services Air Ambulance Services, as well as a project at the Foothills Medical Centre in Calgary, which is trying to make it easier for patients to find their way around the massive health campus. The study into shared decision-making in primary care and community-based mental health settings is interesting as it brings to the forefront the need to engage patients in the decision-making around their care. Clinicians are often keen to tell their patients what they need to do. For some, engaging with the patient is a foreign concept. Some patients as well are not good at sorting through treatment choices. They just want to be told what they should do. They trust their doctor. In the shared decision-making study I've been involved with from day one in proposal development, process design, and participant development strategies, helping link out to those from Indigenous communities as well as multicultural communities. In addition, I was able to introduce the project to a group of private medical clinics in Calgary, keen on insisting their patients participate. With my background in human resources, I've also been able to bring my knowledge of performance evaluation to better define the patient role as an active voice on the research team. I'm excited to share my personal patient experience and my desire for system improvements in this exciting project. I look forward to giving patients voice and perhaps refining how clinicians and patients deal with the treatment options available to them.